Hi there, it's Dr. Samji from PhysioMed in Vancouver. I'm here with one of our patients. She's volunteering today for us to demonstrate this really cool technique called pain neutralization technique. Basically, we're going to find areas within the muscle that are sore, tender points. We call them trigger points because they're painful to the touch, and sometimes they can also radiate. That pain can travel to different areas. That's why it's called a trigger point. So we're going to find a few different ones. I'm going to ask her if that's a point that hurts, and then I'm going to apply a gentle reflex at some other site, which I'll show you, and we're going to try and turn that pain off. If we hit the right reflex, it shuts that pain off, and we just hold that reflex for about 20-30 seconds, and then we recheck it on the next treatment, but over time that trigger point goes away. So I'm doing these videos to show you how you guys can do this at home. So the first trigger point I'm looking at for low back pain.
Yes, that's the one.
Right there. So she's saying it's painful right here.
Yes.
This is her gluteus medius muscle. The reflex to turn it off, there's few, and I'm going to use one. Just going to count up to the L2 vertebrae. And I'm just going to push the tissue up, down, and out, just gently.
Yes.
Eva, is that better or same?
If you try one more time, it will be better. Yeah. Yes. Okay. That's it. That sounds better.
Better?
Uh-huh.
All right. So this vertebrae, if we go to L2, it'll shut off pain in this gluteal trigger point region. And we're just going to hold it 20-30 seconds. And then I can even feel under the original hand where the painful trigger point is, I can feel that muscle relaxing. Okay. Now I'm going to go a little bit higher, and I know there's a trigger point.
Yes, that's
this
it.
muscle.
Oh, that's the one.
Okay. There's a few ways to turn it off. I'm going to go to a diaphragm reflex. I'm going to reach under to the edge of her rib cage. You relax, Eva.
Yeah. Okay. Fine. Okay.
I'm just going to push in and towards midline. Does that feel better or same?
Better.
Better.
Yeah.
All right, we call this a diaphragm reflex. So just at the edge of the rib cage, just to the right of midline, and I'm pushing up into the diaphragm muscle and towards the midline of the body. And we just hold 20-30 seconds. Good. Now she has another trigger point in her left shoulder, in her trapezius muscle. That's a very common trigger point.
Yeah.
Is that one tender?
Oh yeah, that's the one I like.
For this one, I'm going to just feel around her neck at around the level of C2. So the top of the neck is C1. Go down to C2 and very close to the midline. I'm just going to use 2 fingers. I'm going to push straight down and just turn my fingers slightly counterclockwise. Does that feel better or same?
Yes, better.
Better.
I can feel it.
So if we hit the right reflex, the original point where I was pressing, you won't feel the pain anymore. Some patients even say, are you still touching that point?
It's better, yeah.
So it's just a reflex to help turn that painful point off. 20-30 seconds we hold it, and then after the treatment we just leave that point alone, and then the next time she's in we recheck it. But over time, what we found, over 24 hours the muscle will start to release, and then sometimes patients come in and I recheck and they're gone. Okay? And if you want me to do this to you, please call us or book an appointment, and we'll do these very gentle reflexes to take
Okay.
your
Excellent.
pain away. Thank you.
Okay, that's great.